I've done pretty much everything under the sun, but, I didn't know the effects of all the drugs that I was doing.
We knew something was wrong. I was with him when I think the aneurysm actually occurred. And he kept saying how bad it hurt, his head hurt.
They told me I had a 3% chance to live the day after the first day of the hospital. I was in the hospital.
He was under so many medications and had tubes and everything. He really didn't know what was going on, and even to this day, he doesn't even remember pretty much any of it.
It was sad because we didn't know what was going to happen. We visited him, but it took progress. Took over time.
I had aphasia, so I couldn't remember how to read, write. Like, I didn't even remember my name at first, the first about week after I got to the house.
He couldn't really communicate real well. If we went out to a restaurant, he pointed the picture of what he wanted to eat. He didn't know how to say it or what it was.
In January of 2012, 3 months after his brain aneurysm, Brad began receiving help at Rocky Mountain Healthcare's BrainCare program. He'd lost memory, much of his functionality, and the custody of his children. He was looking for a path to put his life back together.
Our objective is to help people thrive, and we built a model that starts post-acute coming out of the hospital and helps them re-engage in their life as they used to know it.
When Brad first came to us, he required a lot of assistance. He was living in one of our group homes, which is a 24-hour assisted living. He eventually progressed where he was able to eventually move into our apartments, where he came to our day program 4 days a week, but still lived on his own, and then started working in the kitchen.
Through his passion of cooking, he was able to work under the supervision of the kitchen staff and pretty much ultimately become a Rocky Mountain Healthcare Services kitchen porter.
We do our morning meals. We ship out morning meals. He helps with the service on that. He does the dishes around the kitchen. He does prep work. He helps me with baking.
He's always here. He's always on time. He's got a great attitude, and he works hard. I'm not going to say anything more than that because they don't want to raise.
He never missed a day, whether it be night, whether it be catering an event that the company was hosting, whether it be on the weekends. He was the first to raise his hand.
Brad began making remarkable strides. He received help at BrainCare's Neuro Pathways Center, joined the kitchen crew full-time, and worked to get his own apartment. Once Brad was rehabilitated and able to work full-time, he fought to regain the custody of his children. The BrainCare team had witnessed his progress, and they were willing to stand by his side and testify on his behalf.
He loves his kids. He knows that they've been through a lot, so he wants to make up for that and do his part to make sure that they have a good life.
I think it's amazing that he had the courage to push for his children, to get custody of his children, to graduate from the BI program, to be able to get a home and provide for his children. I just think that's awesome.
I'm extremely grateful that he's come this far so quickly. You know, this is something that could have affected him for the rest of his life where he couldn't function.
The struggles that he endured, the challenges that he faced on a daily basis, and the self-motivation he showed in our program, we provided a great learning environment for him and all the support he needed to pretty much say, I could do it.
He fights through any problems he has, physically and mentally.
I mean, a lot of these guys out there just give up. But Brad just wants to get better.
I think it's a miracle that he's still here.
It's good to know that there was that many people on my side to begin with, because I never really felt like I never really felt that I had anybody on my side near as much as I had. And I'm just glad that I'm kind of glad that it did happen. I just wish I didn't have to almost die in order to do that, to get that.